Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. This is Dr. Craig Stern. Today we will be talking about concerns over the health of the homeless population here in the United States. According to Medline Plus, common health problems related to the homeless population include mental health, substance abuse, bronchitis and pneumonia, and wound and skin infections. Homeless women are typically victims of domestic abuse and sexual abuse, and homeless children have higher rates of emotional and behavioral problems, often associated with witnessing these abuses. Dr. Stern, as a healthcare professional, where do the homeless population, tend to get their care?
Yeah. Alex, I'm glad you brought this up. As I understand it, the population is growing, which is the problem here. Fundamentally, the issue is that the homeless population gets its care locally. So, to be fair, this is more of a local problem than a federal problem or even a state problem. Now, having said that, most counties have county hospitals, or they have hospitals that act as proxies for county hospitals. And they also have either connected with them or separate county clinics with the homeless population. So this is very much of a local issue. It is growing, and those hospitals and clinics have the responsibility to deal with these people. Clearly, when they're independent and they're homeless, they have a bigger problem. They have problems with hygiene. They have problems with regard to nutrition, obviously. And then as a result of that, because of hygiene and nutrition, they have problems with regard to infections, whether they're topical infections or whether they're systemic, where they get systemic infections that leads to upper respiratory kind of problems, etc. So we're dealing with problems that are a result of homelessness and deals with their inability to get good nutrition, get good hygiene, get good care.
Right. Also, who pays for this?
Well, because it's local, it is a local problem that is dealt with by local communities. So we're dealing with hospitals that are dealing with poor people. They fall under disproportionate share, which means that they, as a proportion, don't pay anything or don't pay as much as the general population. So as a result of that, the county hospital, for example, is taking the majority, in fact, all of the cost. Some of it may be reimbursed back to them by the state, and perhaps a little bit through comparison with the federal government in block grants. But at the end of the day, the majority of it is in hospitals, and therefore they're taking it as bad debt.
Right.
And therefore looking at how can they treat these people. Clearly, how can they keep them out of the ER or the hospital, send them to the local clinic to deal with it. And on top, to be fair, there's also federally qualified plans, FQHCs, that are clinics that deal with these people, and they get federal concerns with lower costs, lower costs for drugs under what's known as the 340B program, etc. So the county hospital, the county clinics, and then these federally qualified plans who are trying to give help to the community in order to address these people.
Okay. A huge topic that's been going on in the news has been over the healthcare bills, meaning repealing and replacing the ACA and the BCRA, and whatever other acronym they come up with. But going back a step as to what bill is currently in place, has the ACA helped at all with this the homeless population?
Well, there's two elements to it. One is there's the build of the homeless population that has nothing to do with whether it's the Affordable Care Act, American Health Care Act, or any other act. It has to deal with what's going on in the general economy of the population. It has to deal certainly with immigrants. It has to deal with the population for younger people that can't find jobs that get thrown into this population. So It's not an immigrant problem. It's not a problem with regard to what's going on with the community. It's the economic problem of what goes on in local communities. Now, with regard to that, that's totally separate from any healthcare bill. It has to deal with the build of that population or not. The second issue is healthcare and how those people are being treated. Money was spent, and at least half of the states expanded their Medicaid population in order to deal with those people, so that they were being dealt with monies that half came from the federal government, half came from state governments, and then money was given locally in order to try and deal with that. So from a policy standpoint, the Affordable Care Act did have an impact, and that's why half of the states built and expanded their Medicaid programs. If the federal government decides through one of its iterations, it's certainly not happening now because the Republican bill has failed in the Senate.
Right.
But if they continue with issues with regard to repealing, et cetera, and trying to take money away from these expanded Medicaid programs, then yes, there will be an impact from the federal government on monies available to treat these people. And if there are less monies available to treat these people, then effectively they have nowhere to go other than to the county hospital, the county clinics, maybe to the FQHC. And then all of that money is handled with bad debt by the hospital because there isn't as much money from the state to pay for it. Same thing true of the county clinic. And then separately with regard to what happens with the FQHC, if money is taken away there as well, then clearly all of this money falls on local governments and they don't have the money to pay for it.
Does that just lead to people getting turned away or rejected or just getting no care at all?
Well, from a clinical standpoint, you can't turn people away. They come, they have whatever problems that they have, medical problems, and you have to treat it. So that turns into bad debt for the hospital, for the clinic, and otherwise. If they are problems that are not overwhelming medical problems, then you can treat them and send them away, and they have to deal with the problem themselves. They either deal with, if there's family issues because they're young people and they don't have any kind of insurance, then they'll be taken care of. Clearly under the Affordable Care Act, then young people were covered up to age 26. So that population was covered in what happened to it, and there was coverage. Now, as the uncertainty unrolls with regard to what happens with the federal government, if the federal government decides to let the Affordable Care Act die, which would happen in about a third, 2/3 of it is working, but a third of it isn't working, then clearly there would be a problem. But that would be, the federal government would just be giving up on people. It'd be giving up on people and the care that they need about what happens. So there's two problems. One happens with what is happening with the economy and young people and jobs. And the other issue is the healthcare system. And if people have disease, you can't turn them away. You have to treat them.
Right. Understood. One last thing. What is the benefit of preventative care in the homeless population? And is there any?
Well, the entire healthcare program is moving towards prevention as the primary mode of control, treatment, etc. There has been a major move among the healthcare programs, certainly under federal programs, but even locally. It has nothing to do with federal healthcare. It has to deal with it's cheaper to prevent something than to have to pay for it. Of course. The problem is that if these people are poor and have no other resources, then the major areas for prevention in general don't work. I mean, what is prevention? Prevention is weight loss, exercise, good nutrition. So what's known in the industry is therapeutic lifestyle changes that keeps people well, minimizes they're not obese, so it minimizes their risk for high blood pressure, diabetes, hyperlipidemia or high cholesterol, problems with fat. all of those things require programs that deal with these people and helps them to deal with their problems before they get it.
Right.
And secondly, if they have a medical problem like asthma and you have to control them at home so that you're assured of the fact they're taking their meds, they're inhaling them correctly, they're dealing with it. Similarly, taking their blood pressure at home and controlling it. Similarly with diabetes, etc. All of those things require that there is some sort of a infrastructure that the patient can afford to do. But in the case of people who can't afford and deal with it, then the prevention mechanism doesn't work because there's no infrastructure to help them, whether it's locally at home, where they have all the appropriate blood pressure monitor and diabetes monitor and all the rest of that stuff. There's no impact with regard to weight loss because they don't have good nutrition. There's no impact with regard to exercise. Why do exercise? You don't have any way of cleaning yourself, taking a shower, doing whatever.
Right.
There's no impact with regard to following healthy habits because you don't have the money to follow healthy habits. So in general, that people fall through and the prevention falls through for those people.
Right. Understood. And it's a tough situation to crack. I mean, you try to find answers. You look for ways of preventing this, and there's so many factors that factor into this. But just in healthcare alone, it seems that the rise in the homeless population is also causing a rise in economic hardships for not just for the general population, but also for the hospitals that have to cover all this debt, and rise in healthcare. I mean, rise in the homeless population will also equal a rise in bad debt for a lot of these county clinics and even private hospitals.
Well, let me emphasize something because I think it's terribly important.
Mm-hmm.
I said before, but it's terribly important that we're emphasizing. In the case where the population is growing, it's not just an immigrant population or an immigrant problem. We're dealing with young people that economically are disadvantaged and can't participate.
Right.
And if we take money away from them, then those young people become part of this whole problem. We're dealing with problems with the economy if people can't afford or can't deal with these problems, and we're giving money away to other areas, whether it's not to healthcare, but to other things. This is not an argument to throw more and more money at healthcare. It's an argument that you have to use the money judiciously so that you're addressing it. So we're not just dealing with some sort of a unifocal issue about immigration or illegal immigrants or otherwise. We're dealing with young people that are growing, that have a problem, even if in the statistics, in the skilled nursing facilities, the population of skilled nursing facilities is beginning to shift away from all these people that are 65 and older, but there's a much larger population, a much larger acceleration of people between the ages of 18 and 64 that are in these homes.
Right.
So not just homeless, but also people that are going to these programs. This is a major problem that needs to be addressed on multiple levels, and you can't just look at this as a one-time fix for one-time things. We have to keep emphasizing that, or else we're not going to be able to address all of these problems.
And one more thing that I feel is more important, or not more important, but just as important. What can the regular general population do to help? Maybe is there someone to contact, or are there shelters that they can help with? Where can the general population go to try and help with kind of bring this all together? Meaning,
That's a good question. That's a good question. It's hard.
Yeah.
It's very hard. So there is no one solution. There's no silver bullet to the issue. But because it's local, it does mean that certainly on the internet, there's places for people to go to identify shelters. Certainly some of the missions that are feeding people to deal with this kind of thing. Furthermore, there are certainly areas where families are going to have to pick up the load to deal with some of the younger people and deal with that. And communities, whether they're church-based groups or social groups or otherwise are going to have to get together and find ways in order to deal with the problem as well. Because if the federal government doesn't give money, and if the states are out of money, and it's a local problem, then the local community is going to have to find ways to deal with it. It's not simple. There is no simple way of dealing with it, but every way that people can figure out in order to have families help out with their disadvantaged individuals, social temples, churches, and otherwise to deal with their communities and otherwise. They all have to get together. It's a local problem, and they're going to have to deal with it locally.
Okay. Thank you very much, Dr. Stern. And that's all we have for today. Please make sure you visit propharmaconsultants.com and feel free to visit our free information page. It's called RxInfoX. We'll have new videos for you every Wednesday at noon. And please like, share, subscribe, comment down below. And we'll see you next week.